Today, I'm super excited to talk about PRP for hair loss, treatment, and hair restoration. Hi, I'm Dr. Angela Yeagley of Sage Health TV. Welcome. So PRP stands for platelet-rich plasma. So you're probably like, what is that? So basically, it is this really cool part of your blood, your own blood, that was discovered that when you pull it out, so it's basically platelets, and you activate them, that they will actually contribute to regeneration of your tissue. So it started studies around it, and it started being used in the 1980s. And they discovered then that whenever you inject it to, say, if you inject it into the scalp, it actually starts encouraging, hair regrowth. If you put it into the face, it starts working on wrinkles. You can put it into joints as well and start, encouraging collagen. So it's a really cool natural therapy to address what we call pattern baldness, excuse me. So what that means is basically just your natural hereditary or natural hair loss that happens over time. And that's in men. For a long time, it was thought only in men, with the balding in the back or reducing in the front. But women actually have that too. And I'm sure there are women that, you look at your mom or you look at your grandmother and you start seeing that, and actually PRP is a really nice, viable, natural alternative that can stop that or slow that down. So I also want to talk a little bit about, what PRP does when we inject it. But actually, I'm going to start with, if you have hair loss, you really need to make sure that there are certain things that are not already, underlying contributing to your hair loss, where it's just going to keep encouraging, like your thyroid is off, or, your stress levels are out of control. And remember, hair is on a 3-month cycle. So somebody who has like a huge stressor, 3 months later, all of a sudden their hair is all falling out. Now, PRP can still work for that, but if it's chronic stress, really need to get in there and address that. Do you have a malabsorption issue and you're not absorbing your protein? We can see that. So if we pull your blood and look at your protein levels, if you don't have any protein, you don't have the building blocks basically for your hair to grow. And that would be the same with your minerals. So if you're really mineral deficient, and usually that would go into like a poor diet where you're not getting, vegetables and nuts and seeds and things like that. So all of these things ideally need to be addressed, including hormones. So one thing that really contributes to, specifically pattern baldness is conversion of testosterone to something called DHT. So DHT is dihydrotestosterone, and DHT is basically the troublemaker. So it increases the hair falling out, also is inflammatory for other things too. So there are things that actually can be done to stop that conversion. So it would be nice, again, while you're having your hair treated, to see what your DHT levels are. Okay, so what is PRP doing? So essentially what we do, we pull the platelets out of your blood, activate them with calcium or oxygen, and then when you inject them, what they start doing is they actually increase something called growth factors. And we think of growth factors a lot of times when we do stem cells, actually. So for people who have had stem cell treatment or have been interested in it, it's the same, it's a very similar mechanism. So the PRP will actually start encouraging the regrowth, or like the regrowth and thickening of the hair follicle, as well as new blood supply to the area around the hair. Also increases keratin and collagen production in the area. So it's pretty cool. So it actually is healing, your hair follicle. So, when we look at who is it for, essentially, again, the longest time it was just thought of for men, but actually women have a higher success rate. So men are probably between 50%, to 60% success rate, just because, again, if those hair follicles have already died out, then you can't bring them back. But what's cool in pattern baldness is mostly it's dormant hair follicles. So many times you can revive them, which is cool, even if you can't see the hair. Women actually have like an 80 to 90% success rate with PRP, which I think is really cool. So, but again, we need to check your DHT. The one thing we have to note is that if there are types of scarring hair loss, it's called scarring alopecia, it will not work for that. That hair follicle is dead. So if you already know you have that, you've been diagnosed with that, then unfortunately this is not a treatment for you. So next, what do we do? So essentially you make an appointment a couple hours before you actually have your treatment. We take your blood. We have a special machine that actually spins it down a couple of times where we can access your platelet-rich plasma. We pull that out. And one thing, not that you have to do this, but if you have a history of sometimes having lower platelets, we actually want to take more plasma. So if you have that blood work and can see that, then we probably would take a little more blood from you than we would someone else. And one thing that I didn't mention here, that we can do, again, it's not necessary, but I really like giving people IV vitamins a couple times because it really nourishes the blood. And I found just over time of doing this that when people do IV vitamins and then they do their PRP, it's just, we seem to, it's like the PRP is more active, more vibrant. And so I highly recommend that if you, are considering this. So we spin it down. And one thing I want to note that, if you're having it done, really no NSAIDs, which is like ibuprofen, or baby aspirin, at least, 2 days before you have it done. And ideally, if you can go a little longer because they impact the platelets, if you can go 7 days without any of that, that's even better. And then you don't take it afterwards either because you really want all that, stimulated healing going on. So first what we do then after we pull your PRP, you come back in, we're going to numb your scalp. So the scalp can be a little tender. It is, so we basically want to put something that really numbs the endings and, and then we can, depending on what your goal is for your hair, sometimes we just focus on the areas of hair loss, but other times we do the whole scalp, which is kind of cool because it makes all of your hair, nice and bushy and grow back. But you have to be prepared that it's going to be a little bit tender. So side effects, really extremely rare. This is your own blood, it's, if there's anything, maybe it's a little itchy, maybe it's a little tender for a couple of days. So a couple things you don't want to do. So you don't want to wash your hair for 24 hours. We just want that PRP to sit in there. And then no hair treatments for at least 48 hours, but ideally 72 because, chemicals on the hair can just really disrupt the healing process. And actually it's supposed to stay out of the sun for at least 48 hours, which I always think is interesting because we always think of the sun as so healing and just not in this situation. So how often? This is actually a really big question because, people, of course, you have your hair injected. You're like, when am I going to have some new hair, right? So when you look at the research, I've had some doctors, dermatologists that do it will say, oh, don't expect anything for 3 months. And that's not my experience. Actually, I typically see within 3 to 4 weeks, people start having some really nice growth and it continues on. So I would expect actually within that time that you would see something. If you don't, then the typical recommended is like, oh, you're probably going to see it within 2 to 3 months. So it can definitely still happen if you don't see it right away. So the goal is essentially you want to do a couple of treatments at least back to back, and that's within 6 to 8 weeks. So you have your treatment and then 6 weeks later you have another one. Some docs, and depending on your amount of hair loss and how you're responding, will do a third one 6 weeks later, and it will make the process go faster. But after that, after you've had your initial treatments, you're probably going to want to repeat it like once every 6 months, so this isn't a curative treatment. Like it's not going to treat them and then, unless again, you've had something that was, caused your hair loss in the first place and you're just, fixing that and you're rebuilding your hair, then you might be fine, but if this truly is a hereditary pattern, then probably you're gonna have to put it on your radar for every 6 months. So, and then other considerations. So, what's really cool is we can also do some other things. Like we also do some amniotic stem cell, which obviously I'm not talking about today, but it's a little stronger than PRP. And that's just stem cells from the placenta, actually. So, and so also very well tolerated. And when you put that into hair, like, and sometimes we do that with PRP, it can be amazing. Some people call it Chia head, you know, just like, whoa, all the growth factors. So there are other options out there to support you. And just to note also, you can do this with like Rogaine or something else. Like, so just if you're doing some other type of hair treatment, you don't have to stop that to be able to do PRP or like an amniotic stem cell to kind of push those growth factors. So, so thank you so much for joining me. If you're watching this because you're about to have PRP with me, I'm excited. This is going to be great. And if you have any questions, please reach out. I would love to answer them. So thank you so much for joining me. I will see you next time.